Did I hear correctly that in Haiti there are certain things in our healthcare system that we can learn from?
Yes, I
So
wouldn't say
what
they're
would
in the healthcare system, because there really isn't a healthcare system, but I would say there are programs within Haiti, and I think they started in certain areas of Africa, but what you're probably familiar with, but many people, direct observed therapy, which is when someone is, well, specifically TB, malaria, HIV, providing the drugs to somebody every single day, showing up at their home, making sure they take the drugs. One of the biggest issues that many people have, not only with HIV or TB, but is compliance. And we've all done it. You feel
in
okay.
mental health, it's the worst.
Well, of course,
Right,
you know.
Really.
But you have to take your medicine for 12 days. In 5 days, you're feeling better.
So
you know,
don't take
so you keep it in your cabinet. Maybe you'll take it the next day, but not 3 times because you know. So compliance is a big issue, and what happens with that is people develop a drug-resistant strain to that drug. And please step in if I'm saying something incorrect.
And this is whether it's Haiti or New York, it's very similar.
Well, and that is why I think. Well, and I'll finish, and I'll tell you why I think that it would work in America. So you have someone every day that goes. In Haiti, we train people to be healthcare workers, communicators, we call them communicators, and they go every single day, and they make sure you're taking your meds. They bring a small cup of rice to cook for you, also to cook for your family. Also, if you're TB positive, they're treating your whole family because people are generally sleeping in one room. So if you're TB positive, it's more than likely your children are going to become TB positive or already are. So to just treat one person in the family does not make so much sense. So the person goes every day and they make sure they take their meds and they're giving it to them, making sure they eat. And while they're there, it gives them an opportunity to talk about washing their hands after you use the restroom or whatever. So it's a whole education model. We have 99% compliance there, which is much higher
than we have here in New York City,
right,
with TB drugs.
Right. So you think about, and it's a TB treatment is an 8-month treatment.
It's at least 6.
At least, yeah, 6 to 8 in Haiti. So you have 8 months. You're going every single day, and sometimes there's two workers that will go, but generally the person assigned lives in their community. It could be their neighbor. They could live in the next village, but they're concerned because this is their neighbor, this is their community. They don't want to see their community ravaged by this illness. The same way we could do that here, having community-based workers that go out and spend every day. But the issue here is they can't carry the drugs. They can't pass out a drug because they're not a pharmacist. They're not legal to give something out. They don't have a degree in medicine or any type of healthcare. So they're not allowed to do it. So the patient is required to either be responsible to take it on their own or to show up somewhere to take it. And that's where the compliance falls apart. And in Haiti, and many other, I'm speaking Haiti because that's my personal experience. But when someone's there every day, you're more likely to be compliant.
So in America, understanding the infrastructure and the challenges we have, what would you suggest if you were to wave a wand and say, okay, this is how we implement this here? What would that look like?
Well, we'd have to, I think, re-examine the judicial system and how people are so litigious to sue over everything. Because you can imagine even the issue with these students at FIU that we're putting into these communities. There's certain things they're not even going to be allowed to say because, God forbid, they say, well, you should take aspirin. And that person then gets ill from it. They say, well, the FIU student told me to take aspirin, now we're going to sue the college. So you're so restricted, and it's back to what you were saying with vocabulary and language and dialogue. I think you're very restricted in any advice that you can give because of this whole issue with suing. So I think, to me, that would be the first
So
thing.
what you're saying is that, and then I'll be quiet here, but you're saying, okay, tort reform, which is like 2% actually of our GDP, which is a huge amount. If we could figure out in some way how to handle that, we could utilize one of America's greatest strengths, which is the community and people caring, and it's very interesting.